All right, we're gonna roll towards you on the number 3. 1, 2, 3.
I'm Dr. Walpert. We're going to be taking care of you today. I know there are a lot of people around you and it's scary, but we work as a big team.
Well, it might have been a little bit heat related, but his tachycardia never came down. It stayed sustained.
I suggest we transport him, get some fluids on him hydrated.
What's up, bud?
I'm just dizzy.
Okay.
I don't know why.
All right, you feel like you're going to pass out?
Yeah, I just feel real weak.
Real weak?
Yeah.
Okay, let me get a pulse real quick on you.
If I'm not suspecting trauma, I'm simply going to go to a head tilt, chin lift. The purpose of this video is to train healthcare providers in the proper removal of football equipment with a suspected head and/or cervical spine injury. In this emergency department scenario, we'll take a student athlete step by step through this process, from the initial evaluation by the physician to equipment removal to the follow-up physician evaluation and neurological evaluation. We will utilize a team approach with physicians, athlete trainers, and nurses. As every situation is different, we'll utilize a variety of different techniques and show different options, from the lift and slide to the log roll to the tilt. One of the tenets of emergency medicine is advanced preparation. This holds true in particular when we're dealing with emergency equipment removal with football players. Football equipment in general with helmets and shoulder pads can be very intimidating for those who are not familiar with it. We recommend that all emergency department personnel, physicians, nurses, OR techs, and so forth, do at least an annual review with removal of football equipment immediately prior to the season to familiarize themselves with it.
Athletic teams are successful because of good teamwork, and that doesn't only apply to on the field, but it also applies to the healthcare team. And the healthcare team can consist of physicians, nurses, athletic trainers, emergency personnel, and other people who are available and help with an emergency situation. A suspected C-spine injury or a known C-spine injury is a critical and emergency situation, and therefore it requires good teamwork to ensure that there is safe and efficient removal of equipment, and then progressing to efficient, expedited diagnostic evaluation in order to ensure for quick and efficient treatment and hopefully good positive outcomes.
One of the challenges in emergency medicine and emergency neurosurgery is evaluating someone who's had a major injury. And it's particularly true of an athlete with a lot of equipment. It becomes important to learn how to take off equipment to allow for a rapid examination of someone in detail to look for neurosurgical or neurological injuries. And as we get into an emergency room setting, we're really not able to fully evaluate someone radiographically for the depth of the injury with all of the equipment in place. As the examination becomes more in depth and we try to really ferret out where the deficits are and then move on to treating those critical injuries, that cannot be done with equipment in place. Part of the exam is determining that the athlete doesn't have any further injuries, and you really cannot do an adequate exam of the head and neck and upper chest with the equipment in place. When we talk about examining someone in the emergency room, it becomes very important to use all of the tools we have at our hands to fully evaluate a spine injury. It really allows us to treat that injury to the best of our abilities and to keep the athlete safe. With shoulder pads and a helmet in place, X-rays, which are the first line of evaluation, really are very limited. There is a lot of artifact caused by the equipment, and it hinders us in figuring out exactly what the injury is. As we move on to things like CAT scan and MRI, depending on the injury, we're really not able to visualize the spine, the spinal cord, the lower brainstem with any of those pieces of equipment in place. So it becomes very important in determining the level of injury, the extent of injury, and how we're going to treat that athlete to get the equipment off.
In the emergency department, it's very important that all the personnel know how to remove specific equipment when it comes to athletes. The most specific situation is a football player. They come in with very specialized equipment that can be very difficult to remove. What's important in the emergency department is not only to make sure that all the personnel know where the tools are, but how to properly use the tools when removing a football player's equipment, and also knowing exactly the specific technique in removing the equipment prior to any radiological studies.
Taylor, I'm Dr. Walpert. We're going to be taking care of you today. I know there are a lot of people around you and it's scary, but we work as a big team. We're going to tell you everything we're doing as we move along, okay? Are you hurting anywhere?
My neck hurt.
Okay. Any numbness or tingling anywhere?
No.
All right. The first thing we're going to do is get some of these straps off so we can get a better look at you, okay? I want you to lie still and just let the team work, okay?
Okay.
All right. Let's go ahead and get these off.
Okay. Take our gear off. I'm going to maintain C-spine. Let's start at the head and work our way down. We're going to take the tape off the top of the helmet, the chin strap, and then we'll go with the straps next, one by one. Taylor, I'm going to keep your head nice and still. We're just going to slowly take all these straps off.
Taylor, now that we've got some of the straps off, I'm going to do a quick exam. I want you to be as still as you can, and I want you to tell me if I hurt you, okay?
Good.
All right. First thing I want you to do is look here at my nose. Look right here. Good. Now look at my finger, and I want you to look all the way this way and this way. Look up and down. Good. Now, I want you to hand me your hand and squeeze as tight as you can. Now pull hard towards your chest, real hard. Good. Can you bend this knee up at all? Just keep it up there. How about this one here? Very good. Now I want you to pull your toes towards your nose and push down. Good. Perfect. Everything looks like it's working really well right now. So the next step is for us to get some of the equipment off so we can do a more thorough exam. Again, it's very important that you let this team work together. You just be still. Tell us if it hurts, okay?
Okay.
Okay. Let's get the equipment off.
In the emergency room situation, when removing football equipment, it's important to know a couple of factors. One is the number of personnel available to do the appropriate lift to remove the equipment. The second is the type of equipment itself. There's many manufacturers of shoulder pads, and there's many different styles of shoulder pad closures. In this version, there's a swivel front with biothane holding the two pieces together. The biothane can be cut easily with a pair of Super Pro scissors or emergency shears. However, some manufacturers use plastic to bind the two sides, and this plastic is very difficult to cut even with a cast saw. The back of these shoulder pads also has some challenges. The back of the shoulder pads have a lower back plate and also a flat back plate that has to come out from underneath the individual, which you have to take into account for when you're removing the equipment. Another type of shoulder pad that's utilized is, again, a closed front with one strip of biothane. Again, this biothane can be cut with a pair of Super Pro scissors or emergency shears. If this were solid plastic, the only way to take these shoulder pads off are straight over the individual's head using the elevated torso or tilt technique. This set of shoulder pads also has a lower rib belt attached to it. This lower back pad or lower rib belt is another challenge when trying to attempt to remove the equipment over the head of the individual. The more traditional shoulder pads have laces in the front. Laces can easily be cut. The pads can then be bivalved in order to remove them successfully using either the levitation technique the log roll, or the tilt technique. A set of shoulder pads that has a rib belt attachment that goes all the way around the individual's body is very difficult to remove using really any of the lifting techniques. Riddell has come up with new technology called the ripcord shoulder pad removal system. In this situation, the keeper on the ripcord can be cut, the ripcord can be pulled, the shoulder pads are then bivalved in the back with a release mechanism that allows you to remove the shoulder pads without ever having to lift the individual up. When removing football equipment in the emergency room, typically the player will come in with the face mask removed. However, if that's not the case, the face mask will have to be removed in order to remove the helmet in a safe, effective manner. There's a number of helmet manufacturers, and each manufacturer's helmet has its own specific set of challenges. This is a Schutt helmet. Schutt has a very nice quarter-turn quick-release system for the face mask. Once the quarter turns are released, the face mask is then released by turning the face mask slightly and pulling forward. However, pay close attention to how the chin strap is routed. Sometimes the chin strap is routed through the face mask. Because of this, the chin strap has to be cut first at the top only prior to removing the face mask. Another typical helmet is a Zenith helmet, which has no quick releases. However, typically a power drill or a handheld screwdriver can be utilized to remove the face mask. The Riddell helmet typically has quick release clips on the sides and screwdriver clips on the top. These can easily be cut with any of the number of shears that are available. The type of tools used are important as well. The FM extractors, the number 3, number 2, small power drill, handheld screwdriver, trainer's angels are all important tools when it comes to removing face masks. Each one of these tools should be available to the emergency room physician in the event the face mask is still in place when the athlete enters the emergency room.
Okay, Taylor, what we're going to do next is take your jersey off and open up your pads. So I want you to stay completely still. I'm going to hold your head the whole time. Mike and Philip are going to come in here. We're going to split your jersey, and we're going to go and open up your shoulder pads. So Mike, let's go ahead, and Philip, we're just going to do a T-cut. We'll take it from sleeve to sleeve and then straight down the middle. Doing good.
After we've removed the jersey, we're going to go ahead and open up the front of the shoulder pads. In this way, I can take inline stabilization from the cervical spine from Ron while he removes the helmet in a cephalad position. I'll cut the biothane straps on either side. And as we discussed earlier, this set of shoulder pads has swivel clips with biothane. I'll be very careful that I don't cut too far up and injure the athlete's face. The next thing that we're going to do in order to remove his equipment is we're going to remove the sticky blocks. Ron's going to maintain inline stabilization as we do this. We're going to try to gently remove the sticky blocks from either side by peeling them from the spine board. The next thing that we're going to do is we're going to go ahead and remove the chin strap. Again, Ron's going to maintain inline stabilization from above as I remove the chin strap below. The chin strap should never be removed by attempting to pry it from the clips. Instead, it can be cut at all 4 straps in order to remove the chin strap without creating excessive movement in the spine. The next thing that's going to happen is I'm going to come from below. I can use his chest as a fulcrum for my hands and for my forearms as I slip my fingers underneath his head without getting my fingers under his cervical spine. The older fashion helmets, we would have to remove the chin strap and the cheek pads, not just the chin strap alone. The newer style helmets, we're able to go ahead and take the helmet off without removing the cheek pads because of the design. The way that we're going to do this is I'm going to let Ron know that I have stabilization. He'll release stabilization, and then he'll go ahead and remove the helmet by rocking it slightly forward and pulling it directly cephalad. Ron, I have C-spine stabilization.
Okay, Taylor, what we're going to do now is really slowly and carefully. I'm going to take your helmet off. Mike has your head and your neck. He's going to hold it completely still. So I'm just going to slowly take your helmet, and I'm going to very gently slide it off your head. There you go, Philip. Okay, Mike, I have C-spine. You can release.
In this scenario, we're going to go ahead and use the levitation or the lift and slide technique to remove the shoulder pads. This requires a minimum of 8 people to do this properly. What we're going to do is we're going to elevate the individual up off the table. I'll drop the shoulder pads out, underneath, and to the side. As I do this, I have to be very careful that I don't snag the individual who's holding inline stabilization with one side of the shoulder pad.
Okay, Taylor, what you're going to do, we're going to lift you up very slowly and carefully, and we're going to take these shoulder pads off. So I want you to relax. Let us do all the work, okay? Okay. Everybody listen very carefully. We're going to do a lift and slide. On my count on 3, we're going to pick them up at 12 inches. We're going to hold in there while Mike takes the pads off. When Mike says the pads are clear, we're going to say lower on 3, and on 3 we're going to take him back down. Everybody understand?
Yes.
Okay, we're ready. Okay, 1, 2, 3. Very good. Now keep him still right here. Mike's going to slide these pads out in the jersey.
Ron, I'm clear.
Okay, we're going to lower on 3. 1, 2, 3. Very good.
In this scenario, we're going to demonstrate the log roll technique in order to remove the shoulder pads. Remember, there's 2 conditions that we have to take into account: the number of personnel available, as well as the type of equipment. The log roll technique involves at least 4 to 5 people in order to take the equipment off effectively. What we're going to do is we're going to go ahead and we're going to log roll the individual to one side. We'll be able to go ahead and cut the shoulder pads in the back, and Dr. Walpert will be able to come in and do another neuro exam.
Okay, Taylor, what we're going to do, again, I want you to be perfectly still. Let's do all the work. We're going to count to 3, and we're going to slowly roll you over on your right-hand side and leave you there just for a short time while we cut your pads in the back, take them off, and then we're going to roll you back over. You understand?
Yeah.
Okay, you ready? Okay, guys, we're going to do a log roll and get everybody in position. On my count on 3, we're going to slowly take him over. Is everybody ready?
Yeah. Yes.
1, 2, 3.
Let's take them over further. I can't cut those, so we're going to have to take them and slip them out underneath him.
Is everybody ready? 1, 2, 3.
Make sure I don't
Yeah.
snag your hands around.
I'm clear. Okay, pads out, we're clear. Dr. Walper's going to come in. She's going to take a look at your back real quick. You doing good, Taylor?
Yeah.
Is any of that hurting you, Taylor?
No.
Okay. Are you sore up here at all?
A little.
Okay. All right. We're going to roll you back down. Let us do the work, okay?
Okay, we're going to lower on 3. Ready? 1, 2, 3. Very good, guys.
In this scenario, we're going to demonstrate the tilt technique or the elevated torso. This set of shoulder pads does have a strip of biothane that can be cut. However, we're going to demonstrate this lift as if this were plastic. A number of manufacturers have closed front shoulder pads that you cannot cut. This is a very difficult technique to perform, and the pads have to go cephalad. So in order to do that, we're going to use the tilt technique. Have you come on in? And Ron's going to take over the commands.
Okay, Taylor, again, what I want you to do is completely relax. We're going to do all the work here. we're going to keep your hips and your legs on the table, and we're going to slowly bend you up, keeping your neck still, just like we're doing a sit-up. But you just relax. We're going to do all the work. Okay, guys, we're going to bring him up about 60 degrees. I'm going to keep C-spine. We're going to lift on 3. Everybody ready?
Yes.
1, 2, 3.
Notice the amount of lumbar and thoracic motion with this technique. Statistically, between 15 and 20% of individuals that have a cervical spine injury have an associated injury in the thorax or the lumbar area. Therefore, you cannot use this technique until the physician clears those areas. Ron, I have inline stabilization.
Okay, I'm going to release and take the pads off. Okay, Taylor, you just relax. I'm going to slowly take this off with the top of your head. Very good. Caitlin? Okay, Mike, I have C-spine you can release. Okay, guys, we're going to lower on 3 slowly. Everybody ready? 1, 2, 3. Very good. Very good. Good job, Taylor. Good job, Taylor.
In this scenario, we're going to remove the shoulder pads using the Riddell Ripcord shoulder pad removal system. This set of shoulder pads is equipped with not only a lower back pad, but also a full circle rib belt. These are the most difficult type of shoulder pads to take off, especially if it's a closed front without biothane. These pads have laces, or if it were biothane, I can cut that. To remove these shoulder pads, we're only going to need 3 people, and we won't have to lift the individual off the table. So the first thing that we've done is we've already cut the straps underneath the arms. I'm going to go ahead and pull the tab on the side to remove the front of the rib belt and put that aside. I will then go ahead and cut the front of the laces, or if this were biothane, I can cut that area as well. There's one small retaining clip held by a piece of tie wire that I'm going to cut in order to remove the ripcord itself. Once the ripcord is removed, we can gently peel the shoulder pads down from the individual on the count of 3 real slow. 1, 2, 3. As we do this, he's going to settle down about 3/4 of an inch, and we're done.
Now that we've got the pads and the equipment off, we're going to be able to do a much more thorough examination of his chest, his neck, his abdomen, and a good neurological examination. So we're going to remove his shirt now so that we can examine his torso. Put your arms down just like that. All right, Taylor, I'm going to listen to your chest a little bit, okay? As we said, you let me know if we hurt you anyway, okay?
Okay.
Any tenderness here at all? And in here at all?
No.
Okay, the next thing we're going to do is put this collar on, okay? You just be still, let us do the work. Ron, I'm going to slide this right underneath.
Okay.
This allows us to keep the neck immobilized while we're completing the rest of the examination. Okay. Now, give me your hands again. Squeeze really hard. Pull towards you. Good. Can you put your elbows up like that for me? Keep them up really hard. Good. You can relax your arms now. Straighten this arm out. Good. And this arm. Push away. Bend your wrists back like that. Keep them back. Very good. Are you sore at all in here?
No.
How about in here?
No.
Okay. Are you sore here?
No.
Bend this knee up for me. Keep it up really hard. Good. Keep the knee, now keep the knee bent. Don't let me straighten it out. And straighten your leg. Keep it straight. Good. Straighten this leg out for me. Keep it straight. Now bend it. Hard. Good. Very good. Relax. Do you feel me touching you here?
Yes.
Does it feel the same on both sides?
Yes.
How about here? You feel me touching you here?
Yes.
Same on both sides?
Yes.
Here
Yes.
and here?
Yes.
Good. Okay, we're through with the examination now. You can see that having the equipment off now allows us to safely immobilize his spine in a collar. And that allows us to move to radiology where we can obtain x-rays, possibly a CAT scan, and if needed an MRI scan to give us better detail about what the nature of the injury is and help guide treatment as we move along.
In closing, some of the key points that we discussed today were, number one, when removing football equipment in the emergency room, the number of personnel available is critical in the decision-making part of how to remove the equipment. The second consideration is what type of equipment the individual is wearing. As we discussed earlier, there's many different types of helmets and many different types of shoulder pads. Being familiar with this equipment is paramount in effectively and safely removing the equipment in the emergency room should you suspect an individual of having a cervical spine, thoracic, or lumbar spine injury.